Welcome guys to our class today. So today I'm going to take you through diabetes mellitus. So I'm going to tell you what this is. It's a chronic illness whereby there is high blood sugar in the body. It is several conditions that rises the blood sugar beyond the normal ranges due to insulin issues. So we are going to check on the types of diabetes mellitus. So there are three types of diabetes mellitus, one being type 1 diabetes mellitus. So type 1 diabetes mellitus, it is an autoimmune. It is an autoimmune condition where the immune system destroys the cells that produce insulin in the pancreas. So this one appears at any age, even at a younger age, especially below 30 years. So we have type 2 diabetes mellitus. The type 2 diabetes mellitus, it is when now the body does not produce enough insulin, or the body develops insulin resistance. So this type 2 diabetes mellitus, it is very preventable, oftenly preventable. So we have another, this one I'm going to dwell on this so much because we want to prevent it from happening. The other we cannot prevent, but for this one we can prevent it. So we have another diabetes mellitus which we call gestational diabetes. So the gestational diabetes, it is a diabetes where the high blood sugar develops during pregnancy, and usually it resolves after delivery. But in some cases, it doesn't resolve, so it increases the risk of getting now the type 2 diabetes mellitus. So if a mother gets pregnant, gets the gestational diabetes, it can resolve, or it can proceed to become type 2 diabetes mellitus. So we have been talking about insulin. So we want to see, what is this insulin that you're talking about? So an insulin is a hormone. It is produced by the beta cells in the pancreas. So this insulin, it acts as a key. You see the way you open your door with a key? So insulin is a key in our body that unlocks our cells for them to be able to utilize the glucose. So now this glucose that we are talking about so much, what is it? So whenever you eat food, take food in your mouth, it goes through the digestion process. It is converted into glucose, especially starches. It is converted into glucose. So that glucose gets into our bloodstream. So while in the bloodstream, it goes higher. So when it goes higher, it triggers our brain. Our brain is everything. So it triggers our brain and it tells it we have high blood sugar in the blood. So the brain now sends signals to the pancreas. So through the beta cells, our insulin is produced. So when now the insulin is produced, it uptakes that glucose from the bloodstream. It takes it to the cells for fuel. And the cells mostly is our body, our muscles, the liver, and the fat cells for it to utilize. So like the way I'm talking because my insulin took my glucose from the bloodstream to my cells. That's why I'm able to talk. When you want to carry any activity, you need glucose. So, and that cannot happen if you do not have insulin, or if your cells are resistant to insulin. So you have glucose in the bloodstream, insulin takes the glucose to the cells. So at the cell point, that's where we develop resistance. And why this resistance? I want to explain why this resistance. So this resistance, it comes in, one way, it comes in because of the fat that aligns the cells, especially the abdominal area. That's where our fat is stored mostly. So there are people who store their fat around the abdomen. So those people, they are at risk of developing diabetes mellitus, insulin resistance. Why? So if here is our cell, so this is our cell here, and now you have the cells aligned by a fat layer. This is the fat layer. So this fat layer, it increases the distance from where the insulin, where insulin is, for this cell to be activated. So when this distance is increased, our cells will not be activated to accept the glucose because it will not be able to get to the cell. So that's why we advise people to just prevent this condition. You have to be active. You don't have to be a sedentary life, to stay a sedentary life. You have to be very active. You don't just eat and relax. You eat and work for our cells to be activated. Guys, it's a chronic illness, meaning when you get it, it does not go away. So now before you get it, can we prevent it? Yes, we can. And so I will take you through it in detail. I'll take you through the risk factors and the symptoms. And for this case, he said your cells, when they receive glucose, you use it as fuel, as energy. So what happens if your cells do not receive the glucose? You become so tired because your cells do not have energy. You just feel fatigued. You're just there, just there. And now the glucose now, it remains in the bloodstream. And that's where now we say the blood glucose is high. Okay, guys, in my next video, I'm going to explain more on how it comes in and how we are going to prevent it. Guys, subscribe to my channel to see more of these. Thank you, guys.